Hi, this is the first video that I am creating for nursing research. This is course N433. Who I have with me today is Patty Peebles. She is one of the faculty members here at Goshen College, and she is going to be talking with us today about two separate areas that she is interested in. Patty, the first thing that I wanted to talk to you about today is kind of the work and interest that you've had in traumatic brain injuries.
Yes.
Tell us a little bit of how did you become interested in this? Was this something that you saw in one of the patients that you took care of, or what was it about this topic that kind of sparked your interest?
Yeah. So we had a student last fall in fall of 2016, who had a traumatic brain injury playing volleyball and was significantly impacted by that. And so she needed support to get through the classes, get through her beginning nursing classes. And I really did not know what things were appropriate. I didn't know what to expect for her. I didn't know how long this was going to take. And of course, she was in a difficult space and couldn't really advocate for herself. So that led to searching the literature. What do we know about nursing students, or just students in general, and traumatic brain injury? I got started reading articles. There were some things I wasn't sure that she knew. And so when she got better, excuse me, the following spring, we actually started talking about some of the articles that I had read and talked about whether or not she and I would like to write an article together, since clearly a lot of people didn't know much about traumatic brain injury and how to support students. So it turned into an article that we got published this past year, and it also helped inform the policy here at Goshen College with some evidence-based information, so that we were sure that we were covering that part of it. The administrative part was covered, but we wanted to say a little bit more about the clinical part of it. And it turned out to be a great experience, and really helped both myself and the student see how much it meant to go into the literature and find out what things were happening and what information we did know and what other things we needed to still find out. So it's pretty exciting.
I think it's really interesting, Patty, that this came about due to kind of your empathy and the experience that this student had of having experienced a traumatic brain injury through playing volleyball, and you and others kind of recognizing that she was not functioning as she had been before. Clearly, from the research that you've done, you recognize that once somebody has a traumatic brain injury, that wasn't the time to sit down and inundate her with the research that you were finding. Given that she was a college-age student, how did you kind of approach getting her family involved or other support systems in place for her?
So for this student, because she was an athlete, there was a lot of support already around her, which is actually shown in the literature as well, that especially bigger college schools have a whole protocol of what athletes do before they start the season, so you have a baseline of knowing. So for her, she had a lot of supports in place. She also got connected with physical therapy, occupational therapy, speech therapy, and one other kind to help her in her recovery process.
Okay.
One of the challenges is for students who aren't athletes, making sure that they get connected into that, partly because most of the although it's changing now because of the media coverage with the NFL, oftentimes people think, well, I just hit my head, it really isn't that big of a deal, but it can be a really big deal. Mm-hmm. And so getting the word out and helping education be really strong on campus, both for faculty and for students, so that if somebody gets hit in the head playing ultimate frisbee out in the outside during the spring, that students and resident assistants and everybody knows, okay, this is something that we have to take seriously, and maybe have to get somebody taken into the hospital to get them seen. One of the other challenges with it is that with traumatic brain injury, people can get hit and feel a little bit woozy and dizzy, but then go to the emergency room, have a normal CAT scan, have normal x-ray, everything pretty much checks out, but then we know that symptoms can develop over the course of the coming days. And so it's important, again, that education piece be really strong, so that students, faculty, administration, everybody knows this is what we need to do to make sure that that's okay, because it's not just a knock in the
An
head.
instantaneous kind of, oh,
Right.
you
Yeah, if
have
you broke
this.
your leg, you'd have a broken
Right.
bone and everyone would see that when you have a traumatic brain injury. And given that it could take months for it to heal, and for some people if it's serious, it can take years.
right.
They can feel really strange saying, no, I still am having these problems. And you look at them and say, well, everything
You're
looks
normal.
fine. What's the
Get back
problem?
to class,
Yeah,
right?
why aren't you doing better? So, yeah.
With this topic, again, given that we're doing this for a research class, did you use CINAHL? Kind of what databases were your go-to when you were starting to
Yeah.
kind of look at and try and find different research articles that had already been written on this topic?
Right, that's a great question. So I started, generally when I'm searching for my graduate studies, I start with EBSCO because that can incorporate all of these different search engines.
Okay.
And so I usually click search all, even though it's going to also search an agricultural database. I
Okay.
still end up getting the same information. I always restrict the dates so that I don't have to contend. I've already got to contend with 100,000 articles.
Right.
It just
With such a
knocks
broad
it down
search.
a little bit more.
So you limit your dates to say like the last 10 years, or kind of what target are you looking at when you say dates?
For the, if I am writing a paper, it has to be in the last 5 years.
Okay.
When I was doing this article, I made it go a little bit farther back, partly because there were some seminal articles that had been written, and there's now an international congress that gets together about head injury in sport.
Wow. Okay.
And so I wanted to get back farther and see what they had done and to see
Capture
kind of
that,
the
sure.
evolution of how policies have changed, because
Okay.
there is really good work being done. So that's generally where I start. I also tend to like the smart text searching, which you can either do a Boolean phrase or you can do smart text searching. And then you have an option sometimes of using similar phrases in the articles. And so you can put in your phrase if you're not sure of exactly the topic that you're looking for. And sometimes that can give you really helpful information, or get you to the NIH mesh terms
Okay.
so that you can put those in, because you'll see where other people have published and how to get those keywords.
So
in
you use
your
the
searching.
term NIH, and again, this is the very beginning of research.
Yes.
So explain to us what the NIH is.
So the National Institutes of Health has and it's not a search and it's a database
Sure.
called PubMed, and PubMed uses what we call mesh terms so that they're easily searchable terms. And if you go to the PubMed website and you plug in whatever your search topic is, you'll start getting articles that will say these are the mesh terms to use. And it's sort of a standardized language, much like we would use in diagnosis. Like we always use myocardial infarction, or we use certain terms so that everybody knows that we're talking about the same thing. That can be a super helpful tool when you're trying to search on a topic and you're maybe not quite sure where to start. Sometimes PubMed is a great place to go because it will give you really good directions about where everybody else has already published on this topic. And sometimes you just use that as a springboard to other things. It's really like a detective puzzle that you kind of get used to how to use your terms in different ways and narrow down what your topic actually is. And it's a needle in a haystack when you first start out. And that doesn't mean that you're doing something wrong. It just means that you're learning how to use these engines to your best benefit. And sometimes when I can't find anything along the lines of what I'm looking for, I go to Google Scholar and start there, because sometimes I know the idea of what I want to look for in my head, but I'm not finding what I want in EBSCO or CINAHL or any of those places. So then I go to Google Scholar and just put in whatever broad category. Then it comes out like a Google search, say, oh, this is how people are talking about it in the literature. And then I can go and say, oh, this is how it works.
So when you were picking out terms to look at traumatic brain injury, it seems a little bit maybe straightforward with this one. I assume that just typing in this concept of traumatic brain injury probably, I would assume, got you lots of different hits in different articles, but then probably to narrow that down to looking at perhaps specifically college students, did that create kind of another level of kind of narrowing it down, and did that cause a kind of a break in the data, or were you able to actually find data that was done on traumatic brain injuries and college students as articles that were written already?
There are articles that are written about the college student experience. There are some interesting ones comparing the experience of college students with traumatic brain injury versus students that had an orthopedic injury,
Okay.
and seeing how their experiences were different. But so in that case, you could put in traumatic brain injury, and then under the "and" category,
Uh-huh.
you can just add in collegiate level or secondary education
Okay.
or something like that to narrow it down. The other thing is that once I found some really good articles that were zeroing in, I looked at their result list or their reference list,
Okay.
so that I could really see, so who else are they using. And if I had gone through 4 or 5 articles and they all mentioned this one article, I would for sure go back and check out that article to see, like, everybody's referencing this, so what is it about that article that gives such helpful starting information. So that is one way. And then you could also say traumatic brain injury, not military injuries.
Yes,
So
because
you
you
could
have to limit
specify
out
that.
ones that you're not looking at.
Mhm.
I think that Patty brings up a really important part for you to kind of hear as new to research students, that she was mentioning when she finds an article that she's really engaged with and maybe some pieces are missing or it's just a really good article, that it's not cheating from an academic standpoint to
Absolutely.
look at the work that they did and the reference list that they are providing to you, and going back and looking at some of those works and saying, oh, hey, great, I read this article and now I know about this other article that also has applicability to my topic. And so again, use those reference lists as a way to help you find other sources. As you mentioned, you actually were able to kind of write this up as a paper. Talk to us a little bit about, I've never published something, so tell me, how did you go about doing this? Just
Mhm.
spell that out for us.
All right, well, so this was definitely my first time doing this,
Okay,
and I
good.
was not really sure what to do. In my master's program, people had said, oh, you should really think about this. They would say that to our class, and I think everyone was kind of like, yeah, that's not going to happen. But then I went to a conference and presented a poster presentation, and I thought, you know what? The people who are here doing this poster presentation are just like me. They're not some special godlike people who have some special skills. They are people like me who just went ahead and went for it.
Perfect.
So I thought, well, what's the worst they can do is say, no, we're not going to publish your article. So I knew that this was going to be mostly directed toward nursing faculty, so I looked at some of the nursing faculty journals and found one that I thought fit the most closely, and which meant I just flipped through some issues. I didn't do some in-depth study.
Sure.
And then when you go to their website, it gives you submission guidelines, and
Okay.
they say that we want an abstract that's this many sentences long, we want a title page, and then you give them a version of your article that has no identifiers on it, so that the people who review your article, the peer review process, have no idea who you are, where you're
Okay.
from, anything. So that was pretty helpful. And then I had to fill out some online paperwork and submit it, and probably 4 months later, we got back a list of comments from the 2 people who had reviewed the article
Okay.
and the editor of the journal,
Perfect.
which was really helpful because they noticed things about the article that really were needing some work. And at first I thought that would be kind of an embarrassing process for them to see all the things
Right.
that weren't written very well. But then it was a very warm and collegial process. And it was a kind of a daunting list, and at this particular journal, they make you fill out, like, write down each comment that was made to you and how you addressed it.
Okay.
Because
sure.
I'm sure that it would be easy to take all
Just-
these
Yeah.
and just say, well, yeah, I took care of that and not really change
Right.
anything. So we resubmitted it then, and not long after, because they're eager to get stuff
Published, I'm sure. Yes.
not long after, it was published after that. So it was a months-long process. Start to finish, it was actually about a year, but there were long chunks of time in there where we weren't doing anything.
Okay.
We were just waiting to hear from them. So that was actually a really enlightening process, and it also took the mystery and terror out of it to see,
Right.
oh, normal people can do this. You don't have to be some special brilliant person if you have, of course I am special.
Of course you are, Patty.
We're all special. But you don't have to have some superpower in order to be able to do it. And so you could look at your clinical setting and say, you know, we're having a lot of oral infections, or we're having a lot of whatever
Yeah.
the issue is, and you can do something about that. You can look and say, this is what